Hi, I'm Kristen Sewell with Michigan Health Council. Thank you so much for joining us today. I'm standing in the Detroit Institute of Art. Behind me is one of the most beloved murals from Mexican artist Diego Rivera. It depicts Michigan's technological, cultural, and human history. When most of us think of Detroit, we think of the auto industry, but the healthcare industry is represented here too. It's represented by this panel called Vaccination. Throughout the day, we're going to show you some noteworthy places in Michigan related to equity. They're worth knowing about. Now let's welcome our first speaker. Our keynote speaker is Sue Hassmiller, the nursing advisor for the Robert Wood Johnson Foundation. In partnership with AARP, Sue directs the foundation's Campaign for Action, which seeks to ensure that all Americans can live a healthier life, supported by a system in which nurses are essential partners in providing care and promoting health. Sue's joining us today to talk about the recently published report, Future of Nursing 2020-2030, Charting a Path to Achieve Health Equity from the National Academy of Medicine. Please welcome Sue Hassmiller.
Good morning, everyone. I am so happy to be here with you. I wish I could be there in person. Thank you very much, Melanie and Kristen, and thanks to all of you who have taken time out of your day to attend this awesome conference to learn how you can advance health equity. I'm always so impressed with the conferences that the Michigan Health Council puts on. I'm thrilled to present to you findings from the new National Academy of Medicine report, The Future of Nursing 2020-2030, Charting a Path to Achieve Health Equity. The report arrives at an inflection point for the nursing profession. The past year has increased our visibility, but it's come at a great cost. I think everyone would agree. Nurses are emotionally spent from caring for COVID patients. The pandemic has also laid bare the stark inequities that have persisted across generations. Those of you from Michigan have seen how the Black and brown communities in Detroit have been hard hit by COVID disparities. Detroit and other places in Michigan, I might add. Our country needs a stronger, more diversified nursing workforce that is prepared to provide care, promote health and well-being among nurses, individuals, and communities, and address the systemic inequities that have fueled wide and persistent health disparities in our country. This report is aspirational and ambitious. The future of nursing during the next 10 years will be about creating a more fair and just world for everyone, and all of you will be helping to create that world. This report is the second major report released by the National Academy of Medicine on the future of nursing. The first report pictured on this slide, I hope everyone recognizes the first report. It reconceptualized the role of nurses in transforming the healthcare system. The Robert Wood Johnson Foundation and AARP formed the Future of Nursing Campaign for Action, a nationwide initiative to advance the report recommendations. The nursing community, including the Michigan Health Council, and many of you mobilized to strengthen nursing education and advance practice, promote leadership, and increase workforce diversity. The Michigan Health Council, one of the co-leads for the Michigan Nursing Action Coalition, has focused on board leadership and diversifying the nursing workforce. Together, we built the capacity of the nursing workforce to expand high quality care to more Americans. This new report builds on the gains that we have made, and we are still building those gains. So as the nursing field built its capacity, we started to ask, to what end? We knew that the United States spends more than 3.5 trillion per year on healthcare, but underperforms on nearly every single metric. It's really a sad scenario. Life expectancy, infant mortality, and maternal mortality are all worse in the United States compared with other developed nations. Disparities in healthcare access and outcomes related to race, income, geography, and other social and environmental factors are also common. And this slide shows that individuals who earn less in the United States have lower life expectancy. But we also knew that nurses have a long history of tackling the many social and economic drivers that affect health. Nurses are the largest and most trusted segment of the healthcare workforce. They work in a range of settings, and they're often the first and most frequent healthcare contact with individuals, families, and communities. In 2019, RWJ asked the NAM to chart a path for the nursing profession to reduce health inequities and improve the health and well-being of the nation. NAM planned to release a consensus report in December 2020. But I think we all know what happened then. The pandemic happened, followed by ongoing calls for racial justice, and we realized that the only way for this report to be relevant was to delay its release to incorporate the pandemic's lessons, the devastating toll it's taken on nurses, and the ever-growing calls for racial justice. The report is being released during a critical time in our nation's history and in nursing, when it's clear we must dismantle structural and interpersonal racism to eliminate inequities. Nursing needs to be at the forefront of creating a more fair and just world, and we need policy reforms to unleash our potential. The report's vision is audacious: the achievement of health equity in the United States built on strengthened nursing capacity, diversity, and expertise. Achieving health equity is the most salient issue of our time, and this is nursing's time. Let me repeat that. Achieving health equity is the most salient issue of our time, and this is nursing's time to help lead the charge. My hope is that all of you participating in this conference will take on roles that advance health equity. Our country has long failed to give everyone a fair and just opportunity for health. Health is greatly influenced by access to jobs that pay a living wage, safe housing, reliable transportation, walkable neighborhoods, good schools, fresh food, and adequate green spaces. Factors like our race and ethnicity, income level, sexual orientation, disabilities, and the conditions where we live predict where we are more likely to suffer from preventable, costly medical conditions and live shorter lives. Compared to white people, Black, Indigenous, and Latino individuals are more likely to live in neighborhoods that lack healthy food options, green spaces, places to exercise, safety, and have more pollution. This is due to structural racism, defined as a system in which public policies, institutional practices, cultural representations, and listen to this, and other norms of work in various, often reinforcing ways to perpetuate racial group inequity. Redlining, as I show you here in this slide, for example, was used throughout the country in the 1930s to keep Black people restricted to certain areas of a community that lacked social and economic resources. This slide shows a map of Detroit, with the yellow areas defined as definitely declining and the red areas as hazardous. Banks were encouraged not to support loans for home ownership in these areas. The map was produced by one of the New Deal's most important agencies, the Homeowners Loan Corporation. Flint, Michigan offers a stunning example of systemic inequities. The short story is that after switching from the city's water source from Lake Huron to the Flint River, a purely cost-driven decision, a local pediatrician discovered an alarming spike in blood lead levels in the city's children. You all remember this, yes, but that's not the whole story. The people who grew up in Flint knew the history of the Flint River, which has suffered from the impacts of running through an industrial community. The Flint River has actually caught on fire twice in the past, but no one in leadership consulted the community when making the decision to flip the switch. The community was routinely left out of conversations about decisions that directly impacted their health. That is inequity at its very worst. And no one in leadership listened to the community when they complained about the color and the odor of the water. The community even voted to move Black to move back to Lake Huron water, but the city's emergency management officials refused, despite the fact that General Motors almost immediately switched back to Lake Huron water in their Flint factory because the Flint River was just too corrosive to the parts on the assembly line. I'm going to pause for a moment and let that sink in. General Motors wouldn't use the water, but the citizens of Flint had no choice and no voice. These are the kinds of system level inequities that pose a burden to health and well-being. And make no mistake, this would not have happened in a white, middle, and upper class municipality. These structural inequities and racism experienced by people of color on a daily basis leads to stress, poor physical and mental health, and the advent of chronic conditions sooner than among white people. These factors also put Black and brown people at higher risk for COVID. Low-income individuals and people of color are more likely to live in crowded housing, rely on public transportation, and be essential workers. They are also more likely to lack health insurance and less likely to be able to access care. This has made it difficult and often nearly impossible to follow recommended social distancing guidelines during the pandemic and puts them at a higher risk of getting sick or dying from COVID. According to Brookings Institute report that was released last March, Black people in Detroit represent over 75% of known COVID-19 diagnoses by race and nearly 90% of all the deaths. The brutal killings last year of George Floyd and Breonna Taylor by police officers and Ahmaud Arbery by armed white men while he was out for a jog, and the unconscionable long list of Black and Latino victims who preceded them and came after them, as well as the well over 6,600 reports of hate incidents against Asian Americans and Pacific Islanders this past year underscore the need to adequately acknowledge, confront, and dismantle all systems of structural racism, including within our great profession. We must all commit to a more just future. And this, ladies and gentlemen, is the future of nursing. This report is intended to meet this moment. It contains 4 key takeaways and a series of recommendations to unleash the potential for nurses to achieve health equity. These recommendations are the consensus of the committee based on the evidence at that given time. RWJF is still thoroughly reviewing and digesting the report, and we encourage other healthcare leaders to all do so as well. The report calls on the systems that educate, pay, and employ nurses to permanently remove barriers to allow them to do this work, value their contributions, prepare nurses to tackle and understand health equity, and fully support nurses. The need to dismantle structural racism and diversify the nursing workforce is woven throughout the entire report. So I'll discuss each of these. Many people in our country can't access healthcare because they lack insurance, the ability to pay, and clinics or providers in their geographic area, particularly in rural and inner city areas. Nurses can help to bridge the gap in access to care. About 70 to 80% of advanced practice RNs work in primary care. The nurse practitioner field has grown while the number of physicians going into primary care has remained stagnant or declined. Studies have repeatedly demonstrated that nurse practitioners provide care that is equivalent to the care provided by our physician colleagues. They are less expensive to employ than physicians and are more likely to care for vulnerable populations, including those and especially in rural areas. However, their ability to practice fully is limited by state and federal laws. This is important, limited by institutional barriers and restrictive health system policies that prohibit them from working to the full extent of their education and training. The report calls for all organizations to enable all nurses to practice to the full extent of their education and training by removing regulatory and public and private payment limitations and restrictive policies and practices. This recommendation continues the work of the first report. Many of you, hopefully all of you, will recall, but it discusses in more detail lifting barriers that prevent all nurses, not just nurse practitioners, RNs and licensed practical nurses from practicing to the top of their education and training. These range from restrictions on providing telehealth services to workplace policies that prevent nurses from providing the best possible care. Until all nurses are permitted to practice to the full extent of their education and training, significant and preventable gaps in access to care will continue. For many people, delays in obtaining care lead to worsening of symptoms and disease progression, and to greater costs when people ultimately do receive care. Nurses can advance health equity through their roles in care management and team-based care, preventive care, community nursing, including serving as school nurses and providing telehealth services. School nurses, for example, are a lifeline for 56 million students, particularly children from low-income families. They detect illnesses early, help manage chronic conditions, and contact trace outbreaks during a pandemic. They also provide mental health care. About 1/3 of student health visits to school nurses were all related to mental health before the pandemic, a need that has grown tremendously. Students of color face more barriers to accessing mental health treatment than others, and structural racism can exacerbate these conditions. But 25% of all schools in our country do not even employ a school nurse. And 35% employ one part-time, sometimes really part-time. School nurses are able to bill Medicaid for services that they provide, but the process is so cumbersome that few really do. School nurses are vastly underfunded and undervalued, and it's unjust. Investments that expand, strengthen, and diversify the community and public health nursing workforce will go a long way in advancing health equity for all. The current payment systems are not designed to pay for services that address the social and economic drivers of health and advance health equity. They often do not explicitly value nurses' contributions to care, as you can see on this slide, takeaway 2. Payment systems can enable nurses to make essential contributions to improving care and outcomes for all patients when they support team-based care, improve communication between providers and patients, and proven interventions and strategies that can reduce health inequities. Nursing roles to advance health equity will only be scaled up if they are valued and paid for. Public and private payment systems should be intentionally designed to support and incentivize healthcare and public health organizations to enable nurses to perform these roles. We need to do a much better job, takeaway 3, of educating nursing students so that they are prepared to promote health equity and improve the health and well-being of everyone. Students need to be better prepared to understand and identify the complex social and environmental factors that affect health, effectively care for an aging and more diverse population, engage in new professional roles, adapt to new technologies, and collaborate with other professions. And here's what I want you to take note of: in other sectors, and adapt to changing policy environment. Collaborating with other partners outside of healthcare will be particularly important in the next decade, including those organizations focused on the social determinants like housing, transportation, social isolation, food insecurity. Developing a more diverse nursing workforce will be key to advancing health equity. The new report unequivocally states that the nursing field needs to address systemic racism and bias within nursing and prioritize diversity and cultural humility, defined by flexibility, a lifelong approach to learning about diversity, and a recognition of the role of individual bias and systemic power in healthcare interactions. Systemic power. For too long, the nursing profession has identified as being a caring profession. Nothing wrong with that. We want to be caring, right? But they have maintained an identity of color blindness. I know that I was so proud when I graduated from nursing school that I was colorblind, but it was really the wrong frame of mind. Color blindness was admirable in its intent, but it was wrong. It unfortunately made us blind to the structural racism that has long existed in the profession. We need to acknowledge and confront structural racism in nursing so that we can address the systemic barriers that keep the nursing profession overwhelmingly white and female. Despite decades of emphasizing diversity, the nursing field remains approximately 80% white, even though the white people make up 60% of the US population. The gap widens further for nurses in leadership positions, including in academia, with about, guess their percentage of nursing leaders coming from white backgrounds in nursing leadership positions. 90%. Unbelievable. We need to do a better job as a field, as well as make sure that all students feel included and welcome. Nursing students and faculty must reflect the diversity of the population and break down barriers of structural racism present in today's nursing education, including in the curricula, institutional policies and structures, and the formal and informal distribution of resources and power. Let me say that again. We need to take stock of the formal and informal distribution of resources and power. All nurses need to communicate and connect with people of different backgrounds and be self-reflective about how their own beliefs and biases may affect the care that they provide. Diversifying and strengthening the student body and eventually the nursing workforce requires cultivating an inclusive environment, recruiting and admitting a diverse group of students, and providing students with support and addressing barriers to their success throughout their entire academic career and on into practice. We also need to increase the number of nurses with PhDs who focus on the connection between the social and economic drivers of health, health equity, and the overall well-being to build the evidence base in this area. I hope that some of you will consider pursuing your PhD if you don't already have it, and focus on health equity. We need to also ensure that PhD nursing graduates can design and implement research that addresses issues of social justice and equity in education and health and informs policy. Nurses with PhDs are also needed to teach the next generation of students. Increasing the number of nurses with PhDs will require financial resources, including scholarship and loan repayment opportunities, and adequate numbers of expert faculty available to mentor, and curriculum revisions that focus on equity. All PhD graduates should have competencies in the use of data on the social and economic drivers of health as context for planning, implementing, and evaluating care, and for improving population health through large-scale data application. Of course, this would be true of DNPs as well. They should also be able to design and implement research that addresses equity in education and health and informs policy. Right now, content about the social and economic drivers of health, health inequities, and population health are not well integrated into undergraduate and graduate education. Nursing education programs should ensure that nurses are prepared to address the social and economic drivers of health and achieve health equity. Schools of nursing need to integrate these concepts and competencies throughout the coursework. Schools should also expand community learning opportunities. Substantive education in the community, such as schools, workplaces, home health care, public health clinics, and telework settings, allowing nursing students to learn about the broad range of care environments and to work collaboratively with other health and non-health care professionals. Students need to actively engage in experiences that will expand and diversify their understanding of nursing practice, prepare them to care for diverse populations with empathy, and allow them to build the necessary skills and competencies to advance health equity. Nurses need to feel healthy and well supported in their workplaces. Takeaway 4. They need to care for people and they need to advance health equity. But the pandemic has taken an unprecedented toll on the nursing workforce. Before the pandemic, many frontline nurses worked in understaffed settings. They were overworked and burned out. Many worried about bullying, and still do, of course, and violence in the workplace. Many also cared for children or elderly relatives outside of their work. Their stresses have only been exacerbated because of COVID. Of the more than 12,000 nurses participating in a December 2020 survey conducted by the American Nurses Foundation Pulse of the Nation's Nurses, most share they are currently experiencing a higher likelihood of depression, anxiety, and distress from when they were surveyed in spring 2020. During the spring administration of the survey, 50% of nurses indicated they were overwhelmed. These feelings have intensified as nurses indicated in the most recent survey, as shown on this slide, that 72% of them felt exhausted. For over a year, nurses have risked their lives and their lives of their loved ones to care for others. They've cared for multiple critically ill patients at once and served as additional support when their families couldn't be physically present. They've used their own iPads to set up calls between patients and family members to say goodbye. And then they've stayed with their patients so that they don't have to die alone. Other nurses have quickly moved floors and have had to rapidly adapt to caring for large numbers of COVID-19 patients, often without adequate training. Nurses are working long shifts. Early on, some lacked the personal protective equipment needed to stay safe. I certainly hope that's not the case now. Over 550 nurses have lost their lives to COVID, a disproportion of whom have been nurses of color. Some nurses who spoke up to demand adequate protective equipment lost their jobs, which is an outrage. They've also faced stigma from the general public. What the workforce has been through is unjust and unsustainable. One of the main imperatives from an ethical advocacy and policy standpoint in the next generation will be to improve nurse well-being so that nurses will be able to provide high quality, safe care and continue to care for patients, families, and communities in the way that they want to. That includes tackling the systems, structures, and policies that create workplace hazards and stresses that lead to burnout, fatigue, and poor physical and mental health among the nursing workforce. The pandemic has also been challenging for nursing educators and students. Faculty have had to adapt to new teaching strategies in a short period of time and rely on simulation-based education experience to replace clinicals. Many programs have had difficulty in ensuring that students have had sufficient hours of instruction, training, and clinical practice. Some students have struggled to complete coursework without computers or internet access, and others grieving the loss of loved ones from COVID. Before the pandemic, nursing students reported feeling stressed out, exhausted, and disengaged. And many of these feelings have been exacerbated. In the last year, it's been a really rough time. Educators need to ensure students' well-being and to give them skills to nurture their well-being during their careers. We need to create a culture where well-being is integrated throughout the entire curriculum in visible and meaningful ways. For example, the Compassionate Care Initiative at the University of Virginia School of Nursing supports well-being throughout the entire coursework, resiliency activities, workshops, retreats, meditation, and yoga classes. To fully support nurses, we also need to address and eliminate racism in our workplaces. Nurses of color repeatedly report experiencing discrimination and bias within their work settings. All nurses need to create a culture of equity in their workplaces. We need a culture of change. Our workplaces should reflect the patient population that we serve, and everyone should practice cultural humility and be aware of their biases. Implicit and explicit bias training and cultural practices accepted and championed by leaders within their institutions where nurses work will be critical. Starting next year, Michigan will require annual implicit bias training for all healthcare workers, and more states should follow suit. Our workplaces need to recruit, retain, mentor, and promote nurses from underrepresented backgrounds, and we need to advance nurses of color to leadership positions, as I said previously, where they are sorely underrepresented. The report includes a number of recommendations to fully support nurses. The main one is that by 2021, nursing education programs, employers, nursing leaders, licensing boards, and nursing organizations should initiate the implementation of structures, systems, and evidence-based interventions to promote nurses' health and well-being, especially as they take on new roles to advance health equity. Nursing education programs, for example, can integrate content on nurses' health and well-being into their programs to raise their students' awareness of their importance and provide them with training and support as they transition into practice. I also want to note that the report calls on all nursing organizations to work together to create a shared agenda. They should identify priorities for education, practice, and policy, and to develop mechanisms for leveraging existing nursing expertise and resources. Creating a shared agenda as opposed to working in silos will focus efforts and ensure that all nurses are prepared in unison, supported and empowered to address the social and economic drivers of health that will eliminate health inequities. The report asks nursing organizations to take actions both within their organization and across organizations. We'll be much more successful if all the nursing organizations, especially those listed on our slide, are collaborating. There are many ways that nursing students and nurses in practice can get involved in advancing health equity, including modeling behaviors that promote a culture of diversity, equity, and inclusion, getting involved in advocacy, being aware of your own implicit biases, and taking trainings to address them. Invest in your own health and identify and disseminate best practices to promote equitable care. Students can also seek out clinicals with organizations that are addressing the social and economic drivers of health. They can also consider getting a PhD and conducting research to build the evidence base for advancing health equity. Even though it might seem really hard for those of you who are frontline nurses and managers to add one more thing to your plate, some acute care settings are helping patients address their non-medical needs, such as food insecurity or housing instability, utility needs, transportation needs, or interpersonal violence. Screening for social needs and making referrals to social services is becoming more common in clinical settings. And I hope you work at a place that's doing that. Healthcare organizations can set aside resources to ensure that people are connected to appropriate services and to follow up to make sure they receive these services. The key is for it to be seamless and not add to the nurse's workload. A great example is Rush Medical Center in Chicago. Rush seamlessly incorporates these questions into care. A nurse asks an admitted patient a standardized set of screening questions about housing insecurity and access to food, primary care, and transportation that appear on the electronic medical record that the hospital uses. If the patient demonstrates a need, the nurse can simply click twice in the computer system to refer the patient to programs that can assist with all of their unmet social needs. The programs reach out to patients after they return to their home to connect them to services in their community. Patients with demonstrated food insecurity also receive a grocery bag packed by volunteers to take home once they are discharged. For nurse educators, you can see some ideas on the slide, including developing competencies to advance health equity, initiating dialogues about racism and inequities in your classroom, mentoring and sponsoring students from underrepresented backgrounds in nursing. Dr. Tanya Bailey, the Chief Diversity Officer at Lansing Community College, will speak to you later today about having courageous conversations, and you'll be able to take some of what you learned from that session back to your workplaces. I really want to attend that session. Be ambitious about what is possible. The report contains exciting examples of what a partnership with a nursing school can be. Graduate students at the University of Washington, for example, spend a year immersed in grassroots work in the community, and then a year immersed in policy that could bring about a whole new level of advocacy. And Washburn University in Topeka, Kansas, has integrated its DMP program with a community clinic that is being constantly improved by the efforts of students and faculty. Nursing schools and practice partners could study these examples and ask, what can we do? The report provides a few attributes of what makes those partnerships great. Things like genuine immersion in the community and opportunities for interdisciplinary and multi-sector partnerships. Nurse leaders can get involved in advocating for organizational policies and structures that support nurses and promote equity. Leaders can shape the day-to-day work life of nurses, set the culture and tone of the workplace, develop and enforce policies, and serve as role models of well-being. Nursing research is vital to advancing health equity. The report calls on various government agencies and foundations to bring together representatives from nursing, public health, and healthcare to develop and support a robust and rigorous research agenda. This includes proposing, evaluating, and scaling evidence-based practice models to advance equity, identifying multi-sector approaches, reviewing and adapting evidence-based approaches to diversifying nursing schools and faculty, determining evidence-based education strategies for preparing students to eliminate structural racism and implicit biases, and improving the use of IT infrastructure to identify and integrate health and social data, like I mentioned earlier. The report includes a table of research topics that needs to be addressed. Researchers, please check out the list of research topics in the report and determine how you might get involved in advancing a research agenda to achieve health equity. An excellent example of a nurse researcher and leader who is advancing equity and that you will get to hear speak later today is Dr. Jade Burns, an assistant professor at the University of Michigan. She leads Young Men's Health Matters, a community-centered research initiative in Detroit that aims to improve health education, access, and outcomes for young Black men in urban communities. The project addresses the critical gaps in the perceptions of young Black men's health and healthcare, and it seeks to build capacity and infrastructure for a community academic partnership between Detroit Community Health Connection, a nonprofit-based health organization, and the University of Michigan School of Nursing. The next decade offers tremendous challenges and opportunities for the nursing profession. I do believe that. More than ever, we need to tap the full potential of all nurses in every setting so that we can achieve what our country needs for everyone, no matter who they are or where they live, to be able to experience good health and well-being. Don't you think that's a fair way of approaching this? It's an incredibly exciting time for students to enter the field. New and established leaders at all levels and in all settings are needed to lead change that results in meeting social needs, addressing social and economic drivers of health, and ultimately achieving health equity. My hope is that all of you will answer the call to create a world where everyone can experience the best possible health and well-being. For more information about the report and to access resources and sign up for the listserv, go to the link on this slide. And so I'm glad now to take your questions. Before we do, I really want to ask you to go to this website, because what I've been working on for the last several months now are resources. So you now not only have the report to print off for free, you can buy it for a cost as well, but you can have other resources like policy briefs, webinars that you can listen to that go down deeper into the details of the report. And we're going to have some podcasts coming out very shortly. So with that, I'm really happy to take your comments. And what I'd like to ask you to do too, as you're thinking about your questions and comments, is to think about everything that I've said to you and sit back and think about what came across to you as most important, what really resonated with you. And let's talk about that. Put that in the chat function. Thank you.